Hey guys, welcome back. Today I'm going to share with you my full interview with Dr. Michael Kim, who is a plastic surgeon, a facial plastic surgeon in Portland, Oregon. He's the surgeon who performed my neck lift, Platysmaplasty, my deep plane lift, and my upper blepharoplasty. Now, in case you missed it, I did do kind of a part one to this video where I share with you my journey. I share with you all the way back to my very first YouTube video, which happened to be about my neck and Kybella, and kind of how I came to decide to get surgery at 47 years old. I am 48 years old now. And then I also shared progress pictures. I shared recovery pictures, the day after through about 5 weeks. And of course, right now I'm about 9 months out. So I did a full interview with Dr. Kim. I shared a little snippet of it in that video, but I wanted to just share the entire interview with you because I asked him a bunch of questions that might really be relevant if this is something that you are researching. If you're new here, my name is Penny. I'm a master esthetician in Portland, Oregon, and I hope that you will subscribe to this channel before you go. I hope you'll follow me over on Instagram because I share all kinds of skincare content there, as well as a little lifestyle and some fun stuff like that. And I also hope you'll consider joining my private Facebook group. We are over 28,000 members now, and it is just a wonderful, supportive, empowering group of men and women who just really are into skincare big time. So I will put the links to all of those things in the description box, and I hope you'll check them out. I'm also going to put all of Dr. Kim's information in the description box. If you are interested in contacting his office about a consultation, they are amazing. So that will be in the description box as well. So I'm going to roll the interview with Dr. Kim, and I'll see you on the other side. Good morning. Thank you so much, Dr. Kim, for joining us today. I was hoping that you could, introduce yourself.
Well, good morning, Penn. Thanks for having me this morning. Yeah, my name is Michael Kim, and I'm a facial plastic surgeon who practices in Portland, Oregon. I have been practicing for about 13 years now after my training had completed. I've been kind of around the United States for all of my training and schooling. I grew up in the Seattle area, Seattle Bellevue area. Went to Princeton University for undergraduate studies, and then came back to Seattle for medical school. Did residency back on the East Coast at Johns Hopkins, and then did a fellowship, 1 year 1 year facial plastic surgery fellowship, and then took a job in Arizona at the Mayo Clinic for 2 years, returned back to Portland, where I was on faculty at OHSU, Oregon Health and Science University, for 8 years, and I started my private practice 3 years ago.
What brought you to doing, specifically down to head and neck and, specializing like you do? Because what I've noticed when, just looking around, there are certain people who only do body stuff. And then, I know that there are plastic surgeons that do everything, but it seems that the people that specialize, those are the people that you want for the thing that you want. And so I'm just curious how you decided to do that part of plastic surgery.
That's a great question. I did residency in head and neck surgery, and 25% of head and neck surgery is facial plastic and reconstructive surgery. And so at Hopkins, I was able to see some really great work, both reconstructive and cosmetic, through some of my mentors there. And I gravitated towards that specialty. And so right around my fourth year of residency, that was the time to apply for fellowship positions. And I was fortunate enough to match in one of the coveted fellowship positions and gain the training to do what we do now.
Can you tell me what goes into determining if somebody is a good candidate for a surgery?
That's a great question. And there are a lot of different factors, but first and foremost, I would say health. A patient has to be healthy enough to undergo elective surgery. So if patients have issues with heart and lung issues, we would at least need to have additional clearance from their specialist to make sure that an elective surgery, such as cosmetic surgery, is appropriate for them and their current health. I think another thing is attitude. Patients have to understand that surgery, it's a process. I know that we always post befores and then afters. I think maybe it would be a good service to others to show what is in between, because it's not always like clear sailing from day 1 to day 180 after surgery. Everyone goes through something.
Right.
And so having the right attitude and understanding that, yes, things are going to get better. And yes, there are going to be ups and downs to the healing process. I think healing is not a straight line up. It's kind of like, hopefully, what like the stock market is, right? There's some ups and downs,
Yeah.
but eventually over time,
yes,
it rises. The other things are expectations. I think that's actually a lot of expectations, and setting them correctly. It's the doctor's job. We can look at someone's baseline anatomy, and a lot of times that will dictate what type of result you can get. And then lastly, I would say personality. I think that you really have to have a fit between surgeon and patient. It's kind of a short-term marriage between the two of you. You spend a lot of time together. You communicate with each other, and so finding someone who can communicate with you on your wavelength and listens to you. And I would say not just before surgery, because that's probably the easy part, but it's during that period of time where you're healing. And is there the ability to shoot an email to the doctor, and are they going to, just give it to you straight and see you if you need to be seen, and talk to you when you need to be reassured.
Yeah.
I think, think about the types of personalities you want to interact with when things are not perfect.
Yes.
I think that's really, really important.
All right. What are your thoughts on other in-office treatments before or after surgery? Are there things that people can do that might benefit them to prep for surgery, like heat-based or light-based treatments? And then same for after.
Right. So there are a lot of in-office procedures out there. And I would say that, some of them are complements and some of them are, I wouldn't say replacements, but can kind of like stave off surgery for a particular set of patients. It's not for everybody. So, there are radio frequency types of treatments that go under the skin, and we offer that. It's called Face Tight. There are some other similar ones like that. People talk about threads as well, injectables, but all those things don't necessarily replace surgery. They might buy a little time. I would say that the predictability of a lot of those procedures and the longevity of them doesn't match surgery. But again, surgery is more invasive, so to speak. However, sometimes, well, not sometimes, but surgery is something that is more durable and lasts longer, but it might not fit people's lifestyle either.
How has your practice evolved over like the last 5 years? The people that you've seen, have you seen a change at all in people's attitudes towards plastic surgery, or have you seen a different set of people? Have you noticed? I'm always curious if you've noticed if people have gotten younger, that come to see you, because honestly, 10 years ago, I would have never in my wildest dreams thought I'd be in my 40s even thinking about plastic surgery of this part of my body at all. So I feel like there must be an attitude shift, and I'm wondering if you've seen that in your office.
Most definitely. I think that I don't have the data to back it up, but my own personal experience will tell me that certainly patients are coming in earlier and doing more things like prejuvenating, doing Botox and fillers earlier than they ever would have thought before, maybe even in their 20s, to prevent the like ingrained lines that can happen with repetitive motion. Doing more surgical procedures earlier, and maybe smaller surgical procedures earlier, rather than, coming in at age 70 and having a massive change, having a smaller change and a refresh so that it's less noticeable. And I think that we've also are now performing some techniques that are gentler and patients can recover rapidly. So I think there is a big shift in that. Personally, for my own practice, when I moved over from the academic world to my own private practice, I think that the trajectory of patients that we see and the procedures that we do has gone exponential. Part of that, I think, is I have an amazing staff and we take care of patients really, really well.
Yeah.
And again, I think a lot of that is frank and honest communication and getting back to people when we tell them we're going to get back to them, and just giving that high-end retail hospitality experience and melding it with safe and good surgery.
So what kind of patients do you think you match best with? I mean, what's your favorite procedure to do? What, out of all of the things that you do, what's your favorite?
Sure. I have a lot of favorite procedures to perform. I'd say that rhinoplasty is one that is one of my top favorites, because I think you can make a change that lasts for a lifetime. You know, it's typically a one-time type of surgery. Occasionally people will need revisions, and I do a lot of revision surgeries from other surgeons as well. But it's challenging because the anatomy is extremely variable from one patient to another. The deep plane facelift is really rising into the ranks there, and it is maybe a close second. And those are really the two procedures I do the most of. And really, I think some of the anatomical and surgical advances that we've been able to come up with over the years as a collection of facial plastic surgeons and plastic surgeons, I think has really enabled people to look more natural, but get a longer lasting, durable result.
Yeah.
And they're extremely rewarding. What I really love about facial plastic surgery is that I get to work with all types of demographics and age groups. And so, you know, it never gets old.
Speaking of those things, can you explain to people what is a deep plane lift?
Absolutely. So the deep plane facelift is, there are a lot of definitions, and it comes down to anatomy. And then there's also additional variations on deep plane facelifts, like an extended deep plane facelift. And I can get into that as well. So just using my face as an example, you know, as we age, what tends to happen is our soft tissue moves down like a pendulum. And so this soft tissue moves down the jawline and it comes up against this area because this doesn't move. And then it basically has a collision course that creates a jowl and then maybe a marionette line as well. The cheek as well comes down this way and creates a nasolabial fold, not because the fold got deeper. It's more because the soft tissue is resting next to the fold. And so no one does a skin-only facelift anymore.
Right.
But what a skin-only subcutaneous facelift would be is actually making incisions of various variations and lifting that up. So there's a small fat layer underneath the skin, and you lift that up. Take the excess and then trim it away. Now, the deep plane facelift, what it does is it lifts that subcutaneous layer, but then it also makes an incision into the next layer. And that next layer is called the SMAS, S-M-A-S. There's various ways to treat the SMAS. Some people will cut a small strip of SMAS. This is underneath the skin. It's called a small strip of SMAS, discard that, and then close the gap. Others will use techniques where they use sutures to just cinch up the SMAS and not make any cut into it. It's oftenly referred to as a max lift, M-A-C-S lift. And then there are various deep plane lifts. So what a deep plane lift typically does is it will actually create a dissection plane underneath that second layer. An extended deep plane lift will take that a little further and will actually take or incise and release an anchoring or multiple anchoring points that keep that SMAS in its place. And so the reason why the extended deep plane lift, I favor it, is because when you free that up, you're able to, without any tension, elevate and secure that SMAS layer, and everything goes with it. So the skin and everything will go with that SMAS because it's doing all the heavy lifting. And so because it has a lot of mobility, you're able to tack it up in a way that has little to no tension. Without releasing that, you can, if you didn't release that and you bring the SMAS up, you may need to pull harder, and then that can give you that pulled look.
Mm-hmm. Mm-hmm.
What's also important is the vector. So the vector of actually where we're going to bring that up. So it's usually the vector that is perpendicular to the nasolabial fold, like that. And we're bringing all that up and attempting to restore soft tissue where it came from.
Yeah.
So the advantage of the deep plane, extended deep plane lift is that there is less of a need for fat transfer in a lot of patients because you actually will regain volume in certain areas where you lost it. It also has an incredibly robust blood supply, which is also very important in patients when we lift up flaps for healing. And then it also, I think most patients bruise a little bit less because the other lifts typically bring a bigger subcutaneous flap, and that's where more small bleeders are versus the deep plane, which is actually less vascular, or you run into smaller vascular issues there. So that's basically a deep plane lift.
Okay.
The Platysmaplasty is a procedure within all types of aging face surgery that you can do as an adjunct. And I often will do it with the deep plane lift. So it's just kind of part of it in most of the cases that I do. What a platysmaplasty is, it's you access it by a small incision underneath the chin. So it's behind the chin crease, so it's virtually invisible. And you will lift a subcutaneous flap all the way around the bottom of the neck here. So in many patients, there are a couple main reasons why to do it. So some patients have a lot of banding, and that banding is actually the center edge of the right and the left platysma. The platysma is a very large sheet-like muscle, thin and wide, that goes right here on one side and here on the other side. You can demonstrate that by kind of showing your bottom teeth. You can feel it flex. And in some patients, even at rest, you'll get these real big bands here. Small bands can actually be, at least early on, they can be flattened with a little bit of strategic Botox injections. Mm-hmm. But if you have a good amount of banding, platysmaplasty is the way to go. Other reason to do it would be if we determine that we feel like there's a lot of extra fat and soft tissue underneath the platysma that can't be reached through traditional means such as liposuction or radiofrequency assisted lipolysis or anything that goes in that subcutaneous layer, because it's not always fat that's above the platysma and between the skin. It's deep to the platysma as well. So in patients who have soft tissue there, and some patients are actually born without a sharp neckline, and it's a way to redefine that cervicomental angle, would call it. Cervicomental angle, all that means is neck to chin angle. And some people, even just through congenital, just from development or heredity, they have a very straight line down that way. And so there are ways that you can create more of that angle. So what does it entail? So that small incision that I was talking about, lifting up that subcutaneous layer, we then find and identify both of the edges of the platysma. We'll actually elevate under the platysma, clear out some of the excess fat and soft tissue. And sometimes we'll even reduce a submandibular gland or part of it, because that can be pretty prominent and hang low below the jawline here. In addition, we sometimes reduce some of this other muscle that's underneath the chin there, called the digastric muscle. And once we're happy with that flat contour, then we actually will bring the platysma back toward the midline, and we will sew those edges that normally are together and put them together. I mean, normally apart and put them together. That then creates this hammock, and we're able to use, through our incisions around the ears from the deep plane lift, we're able to pull laterally, and it just creates this uninterrupted lift here. For some patients, we will actually, instead of just sewing all the way down, we'll actually make what we call our myotomies, like small cuts at that angle, to create or prevent any resurgence of these bands. And that's usually more appropriate in patients who start out with like really prominent bands, because it's just really tight like a string. We're trying to lay that down instead of having that pulling straight from here to here.
So how do you decide when someone needs more than one procedure? Like if someone comes to you and says, oh, I want to do my neck, how do you determine then, well, you kind of also need to do this or that? Do you do a lot of a la carte? Do you do a lot of just necks or just face? Or do they usually marry up better when you do them together?
So it certainly depends on the patient.
Yeah.
And some of what it depends on is age related, genetics related, etc. And so I would say that anyone who has laxity along the jaw line itself and doesn't like some of the laxity over the cheek area, the midface, then I think the lift, in addition to that platysmaplasty, is appropriate. When we do an isolated platysmaplasty, a lot of times we will call it an isolated deep neck lift. So I know the terminology, deep plane lift and then deep neck lift. So there are some terminology differences that can be a little bit confusing. I'd say that the isolated deep neck lift is more appropriate for maybe the younger patient who, just anatomically speaking, was born with an oblique neck. So oblique meaning like that angle is just straight out. And so those patients often will present younger, and they may not have some of the jawline laxity that older patients present with.
Right.
So those patients it's more appropriate to go the route of an isolated deep neck lift.
Do you do isolated facelifts very often?
It's not common. So if patients have no issues underneath here, you can do it. And this is what some people would call like the mini lift type of thing. It's not really common in my practice. I think what tends to happen is a lot of people will try a lot of minimally invasive technologies, and they're unhappy with the results, all therapy, what have you. And then they're wanting something that's more comprehensive and more of a sure thing. Certainly the short scar lifts are possible, but just in my practice, I don't see it as much. I think people are coming to me for specific things.
Okay, so the last thing is, because I am into skincare, I think that it's important, and I would love just a surgeon's perspective. When you see people, do you find that there is a difference between skincare and what you do? And they are mutually exclusive, but they actually kind of intertwine, if you know what I mean. Like surgery isn't ever going to give someone good skin necessarily, and good skincare is not going to replace surgery, often. And I'm just wondering if you agree with that, and if you have any comment on that at all.
I agree with that 100%. I think as surgeons in general, surgeons in general have come around to this, I think, because in the past, I believe that surgeons may have neglected the importance of skin with regards to facial appearance and how rejuvenated someone looks. You know, it's not just about surgery. One analogy would be that surgery is like making the bed, and great skincare is like ironing the sheets. You know, you can still have a wrinkly sheets, but the bed looks pretty good from the distance. But the skincare is so important. To that end, you know, we often will do some reset type procedures for people's skin, and that would be pretty aggressive erbium YAG laser resurfacing. But, you know, doing that is one thing, but then maintaining your skin and getting into the habit of really taking great care of your skin is super important.
Well, I really, really appreciate your time. You know that I love you. So I'm just so happy. I'm so happy with everything that you've done for me. And I appreciate everything that you've said here. You set expectations, and I do just believe that you're an incredible artist. So I will put all of your information down below, and hopefully anyone that's in the Pacific Northwest or beyond, they can give you a call, give your office a call. And I hope that you have a wonderful new year. Thank you so much for being here.
Thank you. You too. I appreciate you as well. And look forward to seeing you in the office again.
I hope you enjoyed that interview with Dr. Michael Kim. Again, I'm going to put all of his information in the description box. So if you're wanting to reach out and do a consultation, that will be there for you. I hope you're having a really wonderful day. I hope you'll check out part 1 of this video, and I will talk to you in my next skincare video. Take care.